I went. No sign of Professor Barrel yet. I don't know if you could get in contact with him possibly. Can you hear me, Wen?
Carl, I'm just on the call with Alan, so he would be on time. Okay, 1 second.
Okay, very good. I can put a message in saying to give us 5 minutes if you like, into the waiting room.
I'm here.
Great, Alan. So
yeah, can you hear me?
Yes, we can. Yeah, clearly.
Okay. Would you like to introduce Wen?
Sure. So
Okay.
Thanks, Carol. So now I'd like to introduce a good friend of mine, colleague Alan Barrio from Cambridge. So today, Alan would like to host this workshop about the future of digital healthcare. So Alan, I leave that to you.
Thank you. I will now share my screen if you will wait 1 minute.
Sure.
I have some pictures to show you. Coming on board now.
Yeah, we can see that clearly.
We get to the beginning. So, can you see me clearly?
Yes,
Hello?
we can. Yeah, yes, we can.
And can you hear me clearly?
Perfect.
Good. So do you want me to begin now?
Please, Alan.
Okay, well, thank you so much, dear organizers, for this invitation to be with you again this afternoon. It is a very great honor and a pleasure for me to discuss this amazing subject, which is very close to my heart, the future of digital healthcare. And it fits very well with your wonderful event, Beyond the Internet of Things. And I wanted to say at the very outset that what I have for you are some observations and reflections, not only from me, but from our base here in Cambridge. And I really want to acknowledge the contribution that my colleagues and dear friends have made to this presentation that I will share with you today. I cannot claim and would not claim all the credit for it. So, the future of healthcare will definitely be digital. The evolution of new connectedness is really something very special. And we are going through a revolution of connectedness in the world. So my context and topics for today's rapid journey, and it will be a rapid journey because I have a lot of information to share with you. I want to say a little bit about the platform of Internet of Things so we know where we're starting from. And there are some big challenges in healthcare we have to talk about. We have to think about people, health, wellness, the complete supply chain of healthcare, and the digital engagement of it. And then we can go all the way from research and development and diagnosis and therapeutics and integrated healthcare, because digital technology impacts healthcare all along the pipeline. And we'll talk a lot about impacts of artificial intelligence and machine learning and bioinformatics. And I'll have some thoughts at the end for you, particular thoughts about how COVID-19 has really impacted the way we have thought about digital healthcare and how it can contribute to the future. But let's begin at the beginning. Anyone that thinks they know about the Internet of Things and doesn't know this man really should be ashamed, but I'm sure you all do. This is Tim Berners-Lee. And we're starting at the beginning, and he, of course, has been the father of digital healthcare and the whole digital age, indeed, the era of connectedness, connectivity, and connectricity, because the internet has enabled us to do all of these things that we're going to speak about today, and we shouldn't forget it. And the digital revolution has been amazing, you know. Since the mid-1980s, we have seen revolution. We've seen revolution in the way in which we can handle data, we can communicate with each other. We shouldn't overlook the fact that we are in a very, very amazing technological revolution. And we all talk today, don't we, about the Internet of Things, the Internet of Everything, the Internet of Anywhere, the industrial Internet, machine-to-machine communication, the Internet of Sensing, and the Internet of Consciousness. So your wonderful meeting and its theme, Beyond Internet of Things, is absolutely right for us to consider healthcare and where it is going across the board through all the things I've just mentioned. And just a quick reminder of what the Internet of Things is. It isn't actually terribly complicated, although it's technically very amazing. So it's a combination of short and long range wireless networks, all connected up now with the cloud and containing many, many apps. I think of the Internet of Things as really intelligently connecting us on our planet, us people, things, animals, environment, machines, through information, through storing, process, decisions, taking action. In a way, the Internet of Things is a bit like a brain in a human body, isn't it, really? It stores up all kinds of stuff and enables us to do things that we might not have imagined some time ago. I did want to pay a tribute to some of the companies that have really made what we're talking about today possible. And we're very lucky in Cambridge here where I live. We have one such, Arm Holdings, one of the architects of the digital world. Now we believe there are about 150 billion ARM designed chips in use around the world, connecting up all sorts of different things with each other and people with things, sensors, chips, and other things. And ARM, of course, are poised to lead the next stages in the digital revolution with their sensors and chips. So let's turn our attention to healthcare for a moment. The big challenges for healthcare, health and wellness. The world's population is increasing dramatically. It's growing older, but not always healthier. We'll look at some numbers on that in a moment. So there is a major role for digital healthcare when we seek to accelerate progress in the adoption and diffusion of innovations of new technology, and in joining up the parts and connecting people and doing a lot more things as well concerning actual diagnosis and treatment. Let's not forget either that we're living in an age, certainly in the developed world, where medicine is changing in terms of the way it's delivered to us people. We have come through a period of hierarchy, highly organized health services, towards something much more approaching a network. Dr. Robert Winter gave me this slide. He worked with us here as Director of Research in Cambridge for some years. But in order to make this change in the way we work together and think of each other, we will be dependent on connectedness. So when we think of all the bits of healthcare, the patients, the doctors, the social services, the pharmacy, the charitable third sector, government, commercial sector, schools and colleges, if we had a portal, and we sort of have them at the moment, they're coming, and they will come more, that connected everything up together so that we could all share when we want to share, we would have a major step forward. So one of the futures of digital healthcare is to make this kind of connectivity possible. Now, we're also looking to a future where we won't be able to afford so many people being in hospital as they are today. So we're looking towards cost-effective, supported healthcare. And that will mean that all these bits that are on the slide will need to be definitely better connected up than they are today. It might be through a card that I carry or everyone carries that has all the information that anyone needs to know about our healthcare, but it will only all happen with digital technology. It's only possible with digital information to have cost-effective supported healthcare. So when we think of a future where hospital managers will be able to use infection control, bed management data to organize the hospitals, where devices that measure different elements of our health and perhaps our ill health and can be connected up together, where healthcare records can be shared between everyone, where the pharmacy can actually accept all the prescriptions in electronic form, which patients then don't have to take in pieces of paper. We're looking ahead, if we can connect and communicate for good health in these ways, to a different kind of world. I've got an example here to show us of how one nation in Europe, this is Finland, is beginning to take account of how to use healthcare to manage how to use digital technology to manage its healthcare system. And digital solutions, home care, personal nutrition, these things are beginning to be connected up. There are innovation campuses. There are biobanks that are connected up with the rest of the system. And there are all sorts of things happening in cancer care. And, you know, as a question that I ask when we begin to delve into these issues of the sharing of health information, and it's not an answer that I'm going to give you today, I'm raising the question, ethically speaking, whose information is my health information? I actually think it's mine, but I wonder, whose information is it and how should it be shared? Now in Finland, they're looking at all these things. They're looking at data, they're looking at genomics, they're looking at patient records through early detection, well-being, health improvement, self-care, diagnostic. This is all becoming a much more integrated part of the healthcare system in Finland. And we'll look in a bit more detail about how some of these elements in the healthcare system do need to be served by digital healthcare, diagnostics, biobanks, big data. Healthcare is complicated. It involves lots of things. And it is going to need a lot of organization and a lot of companies, and the names of the companies are coming on the slide now. It will require integration and coherence between all the agencies, including industry. And from an industrial point of view, and I've worked in health policy and I've worked as a healthcare professional at the bed of the patient, but I've also worked for many years in the industry, and certainly the world digital healthcare market is growing dramatically. And we believe that by 2018, it was certainly over 40 billion in value. I want to just take a step back and look at something we spoke about at a panel this morning. Convergence, the convergence of technology, biotechnology, information technology, nanotechnology, and all of the subsets that I've listed on the slide there. They're coming together. They're working together. You cannot do genomics and genetics without wonderful computing. You need IT to do what you need to do. And these days, people communicate much more openly because they're able to. And open innovation means that knowledge is transferred much more readily between all of us and enables more innovation to flourish. And life sciences and digital technology and the entrepreneurial mindset, we mustn't overlook the entrepreneurs and what they can do, is changing the world of healthcare at all levels. Let's just also consider what's happening in moves away from just group therapy towards personalized medicine, individualized medicine. But to do it, we need a lot of information. We need imaging, we need better pathology, we need facilities, we need all sorts of expertise that can only be marshaled if our communication systems are very, very good indeed. It's essential. And the medical devices area is developing dramatically. Lots of new, sophisticated equipment, co-development with hospitals and industry, beta testing, machine-to-machine contact. All of these things are happening, but they can only happen at the right pace if we can communicate with digital technology. And the whole of the medtech industry, which is a conglomeration of different bits, as we see here, biotech, engineering, electronics, advanced manufacturing, all of that has to connect together. So digital technology is going to be absolutely necessary to make it optimal. Now, let's have a look at therapeutic approaches to disease prevention. Don't worry too much about the detail on the slide, and you can have the slides after my talk and think about it all in much more detail. But we're looking here at how we treat health and disease, all the way from the healthy people who want to retain their wellness and the worried well who think they might be sick, to the sick, to chronic illness, where we want to prevent, we want to alleviate, we want to cure, And we want to do all sorts of other things using diet, pharmaceuticals, and the other elements listed on the slide. There's not one of those areas that will be untouched in terms of its development, and indeed is untouched today by new developments in digital healthcare. I mentioned at the beginning the issue of the growth of the population of the world. Look how fast the population grew in the 20th century, 280%. But look at the numbers, 7.6 billion of us today, and it's going to become over 11 in no time at all. And look at the chart underneath that shows that we're getting older and older, but not necessarily healthier and healthier. Because chronic disorders, which actually take up a very large part of healthcare budgets, affect us as we get older. I am now over 80. Lots of people are over 90. So the aging population and health expenditure is a very big issue. And again, we will come back and see how digital technology is assisting there. 70% of the healthcare budget in my country is absorbed by people who will never get well. They'll never be cured. They are the long-term sick, and they're lovely people. So we want to help them and we want to treat them, but we have to accept that it is very expensive. So then we need to think about trends towards self-monitoring and self-testing, because these help to reduce costs. Acute hospital care is very, very expensive. Residential care is expensive, but the further we move towards the home and the community, we reduce the cost. And that's the trend across the world, rapidly accelerating in the developed world. If we look at the Internet of Things and how the advancement of the Internet of Things has helped physicians, and at the same time, look at the value of the markets that are being developed because technology is being able to do these things and people are paying for it, we can see these areas which are very important. I can't talk about them all, there's not time today, but it just is astonishing to look how much is being affected. Robot-assisted surgery, virtual nursing attendants rather than real ones, automated image diagnosis, clinical trials and stuff like that, connected machines. So if we look at the way in which the market itself is growing, and we have to consider that it should be very attractive to industry, it may be worth as much as 150 billion. And I had some data given to me that showed that the growth in the artificial intelligence market overall in those few short years, 6 or 7 years on the chart there, has grown by 11%. And what about what is going on in another enormously important area? Genetics and genomics, amazing developments in genetics and genomics, in behavioral genomics, in epigenetics, in health and fitness genomics, in all kinds of ways of understanding the genome. Actually, the virus vaccines that we're getting today, and I've had one for COVID-19, was developed largely due to the way in which we can develop these things using genetic information today. And then above all of that and beyond all of that, there's the growth, as we were hearing this morning in a panel discussion, of wearables, ingestibles, implantables. And all of this is moving us towards patient-centric precision medicine, personalized medicine. And I've got a current example of how digital healthcare has been helping us in Cambridge with the COVID problem in the intensive care unit here, where they're using a microarray card system in order to very rapidly discover what bacteria are affecting the patient's lungs. The patient with COVID doesn't just get COVID. The patient, unfortunately, with pneumonia is going to be invaded by a lot of other bacteria as well. And earlier, before recent developments took place, it was only possible to know which was the right antibiotic after perhaps 3 or 4 days of testing. Now, using very, very wonderful digital technology, we can identify and we can absolutely pin down which bug it is causing the patient's infection in hours. And we can then use the right antibiotic quickly, and we might well save a life. Now, we've talked about artificial intelligence, and it is absolutely amazing today just how much data is being developed and moved around. It's mostly unstructured. There are 16,000 hospitals, we believe, around the world, all collecting data. There are huge amounts of data being collected every day. And as you can see, by 2020, someone predicted that the data that is being generated is expected to double every 73 days. And then we've got wearables, these watches, all the things we put on ourselves that also generate data. And all of this data is coming forth, and hopefully some of it is being properly collected and properly turned into information. But without sophisticated artificial intelligence, we can't make all that happen. And we need to make it all happen because we have the big challenge with all these inputs on that left-hand chart. I'm not going to read them out, but these are areas from which data is being generated. Enormous amounts of data, big data. And we need to convert it into usable information so that the right kind of guidance to be fed back to patients on what they need to do as a result of what has been discovered and analyzed. Digital technology will enable those processes. And if we look a little bit more deeply at the challenges of artificial intelligence in healthcare, and again, I won't read all the words out, but there are difficulties. How do we present the knowledge? What do people think about the information when they might get it? People are somewhat wary of data. We can all be overwhelmed by data. And then there are medical limitations. There are misconceptions. We hear on the radio statistics every day that worry us about medical information and data. Some of it is not correct. We need better regulations and legal ways of controlling all of that. And there are many ethical challenges. So artificial intelligence is not the panacea for everything. It can help us a lot, and digital technology can help us a lot, but we need to have controls. Just a few examples here. Don't read the detail, but there's some things listed here of examples of what artificial intelligence has already done for medicine. In the field of diagnostics, medical imaging, predictive medicine, predictive treatment, patient-centric healthcare, administrative functions, loads of areas where artificial intelligence is assisting the clinicians in what they do. And then, of course, when we look at medicine, mobile medicine, medicine related to the Internet of Things, to the wireless technology and the cloud computing, and the ability to put all of that information and store all those apps up on the cloud, and for the patient in one side of the world to put information from a sensor onto the system, and up it goes to the cloud, and back it comes to the physician on the other side of the world in seconds. Wow, this is astonishing technological capability. And if we can organize ourselves appropriately and use it right, we will change the lives of many, many people positively in the future. And just a couple more examples of wearables themselves. And it was very interesting this morning to hear Dr. Stanley Lee from Shanghai, Dingjiang Doctor founder, talking about how wearables have become so important and rather well used in China. Games for health, computer games for health, games that help, for example, the diabetic child live with a little creature that he or she creates that teaches the child about diabetes and how to assist their creature with things they do and things they eat and things they don't eat. It's very difficult for children, to cope with stuff like diabetes. There's a very high level of rejection of what they've got. And games for health can help not only children, but adults too, in moving towards better health. And we all know what's going on in the gyms when the gyms can operate again, or what's going on in the homes or on the road where so many people are now using devices to check many aspects of their lives and their health. And that is all very interesting if it's properly used. If we ask the question, where else will healthcare big data be generated? There's just some examples here. Electronic health records need to be improved. In retail outlets, we could certainly get a lot more from those. And we've talked about wearables already. And in some parts of the world, insurance is a big issue. So there will be insurance claims, which can certainly be helped by big data. And there will be definitely a barrage of new helpful software, which will help us all. Now, if we look at how computer power has evolved over time, don't get concerned with the detail here. All this chart shows is going back to 1900 when Charles Babbage, actually a little bit before that, developed his first difference machine in Cambridge, how computers have come into being and how they have developed amazingly, and how computing power has, as I say here, made the unthinkable possible. And just concentrate for a moment up in the right-hand part of the slide there. In 2015, the power of computers in terms of intelligence surpassed the brain power of mice. And it is thought that by 2023, computer power will surpass the brain power of humans. Now, whether you believe the top statement there, that by 2045, computer power will surpass the power of all human brains, I don't know. But the fact is, it's moving very, very quickly. And Chris Lowe's group in Cambridge came up with this statistic, that computing technology is now progressing more each hour than it did in its entire first 90 years. Isn't that amazing? Quantum computing, of course, is still in its infancy, so it's all going to get more and more powerful. But there are some issues and challenges, and I've only had time to touch on them. The sheer volume of data, the velocity, the speed at which it comes towards us, the variety of it, and the veracity of it. How much of it is truly useful? How much of it is truly accurate? There are a lot of ambiguity. So we have to think about how we manage big data in healthcare in much more detail than we have done in the past. Now I get to another technological, you might say revolution, certainly an innovation, blockchain. Blockchain is often thought of, or mostly thought of perhaps, relative to finance, to cryptocurrency, and to the Bitcoin. And of course, there has been a lot written and said about that. But in Cambridge, at the Centre for Alternative Finance, which is doing a lot of work on blockchain, they're coming up with all kinds of suggestions that this very sophisticated technology that enables communication and information storage to be not only faster and more effective, but more secure. It says it can't be hacked. We have to find that out as we work with it. But the reality seems to be that it is not only in fintech that the blockchain will become very interesting. And Chris Lowe and his group have come up with these thoughts that the blockchain might actually impact in these areas, in research with physicians, in radiology, in patient stratification, in predictive analysis. Who knows? But it's all going on. The people in the laboratories are developing technology for tomorrow that we haven't yet seen. And we all have to think a lot about these new technologies and what we might need to learn about how good they can be. So beyond what we've got today, the sensing and the general approaches that we use to IoT, there's more in the pipeline. Now, we looked earlier at a chart that resembled this, and I just wanted to go back to it to look with some imagination about where digital health and artificial intelligence will progressively impact across the human lifespan. There they are again, the healthy, the worried well, the sick, the chronic. Um, and what we're saying is that in genomics, in disease onset and preventing it, in diagnosis with paramedics, in interpretation of scans and slides and x-rays, and then perhaps in IVF, in autism and mental disease and other areas in sepsis. I've already given you one example of how digital healthcare is actually contributing brilliantly to the way we think about sepsis. So many, many applications across the whole of the lifespan of our health. Now I wanted to add, I made this slide in between my work on the panel this morning and our talk this afternoon, because I heard so much this morning from Stanley and Xing in China that brought me up to date. And I have spent a lot of time there myself, but I'm now brought more up to date on what's going on in China. And, you know, I think in China, when we think of the future of digital healthcare, there are some lessons for the rest of it. And if you want to go online and study, if you don't know about it, some of the things that Stanley Li is doing with Dingcheng Doctor, you'll learn about the major contribution of artificial intelligence and machine learning to the way in which the Chinese healthcare system is being developed. And there is a very rapid development now of online medicine and telemedicine. And there is a significant improvement going on in public understanding of wellness and health due to better communication. And the triage system that Stanley speaks about is very interesting. If you think that in China, for every 1,000 citizens, there are only 1.8 doctors, whereas in my country, there are 6.8 doctors for every 1,000 citizens, you will immediately know that they simply don't have enough doctors. So what Dingcheng Doctor has done is it's reached millions of people and begun to help them to understand better wellness and health. It's done first line diagnosis online of whether there might be something wrong with the patient who has symptoms or whether there might not. It's been able to treat by remote means or advise many of those good citizens of China online, but it will refer to the doctors on its list, those who really need medical care. And that is a wonderful example of the way digital healthcare is changing the whole approach to healthcare in a country. And Stanley also told us that wearables and implantables plus proper consultation online, where the patient begins to trust the wearable information because we can have a discussion with a health professional who can explain it in some detail. This is also having a big impact. And we heard from Xing, the lady this morning who works for insurance company AXA in China, how the insurance industry is beginning to play an integrating role between patients, practitioners, and funders. And that's a very important thing too, not only in China, but will be throughout the world. Now, my concluding part concerns where we are today, the year of the virus, the pandemic. And the pandemic and crisis has brought global destruction, of course. I mean, in my own country, 100,000 people have died. But it has stimulated transformation in thinking and acceleration in certain processes. It would not have done this without digital technology. Health systems devastated, economies destroyed, but when we look at what digital technology has been able to do, for example, in test and trace, communication and analytics, two great examples that actually use these kinds of technologies to control the spread of the virus very, very dramatically. They were the exemplars. My own country has not been an exemplar in using this information to the best effect. because information, digital information, needs to be properly and assiduously applied to get the best results. But if we look at the vaccine area, this has been amazing. Revolutionary in silico digital approaches to understanding the virus and understanding how to develop and bring to market a vaccine in less than a year. Never been done before. Never been done at any other time other than in numbers of years. And digital technology has enabled the vaccine industry and the research people that have supported it to bring the future here today. So just a quick summary, because I did want to leave sufficient time that we can talk about things. At every point of care, at every point of treatment, we see change. So if you look down the column of traditional medicine and future medicine together, where hospitals were the most important thing in the past, they're still important, but homes are becoming more important. Where we looked at groups, we're beginning to look at the individual. We're also working on partnerships and not hierarchies, more on networks. We're interested in people, not just institutions. And the doctors, wonderful people that they are becoming not just the great experts, but our guides and our partners. And that ivory tower of knowledge is no longer an ivory tower, because social media and crowdsourcing enables us all to participate in it. And personalized medicine is definitely on the way. So that's just a summary of some of the areas where I believe for sure digital healthcare is going to be a winner. And there's a picture here to show us how it's also impacting on medical education. Leading edge technology. You don't need a cadaver to do anatomy and physiology today. You've got digital stuff. And bring us all down to earth. Let's not forget that these rather wonderful devices that we carry around with us all day long are also the media through which so much of what I've discussed will be conveyed to us and to our doctors and to everyone, as digital healthcare supports us all in our wellness and our interest in staying that way. So it's all happening: digital communication, artificial intelligence, machine learning. Globalization of improved health and well-being is definitely achievable, and the potential for reimagining and reshaping is with us. Timescales for research and discovery will be reduced, and the cost of healthcare could be significantly reduced. Now, Einstein once said something really wonderful. I'll never forget it. He said, imagination is more important than knowledge. Knowledge is limited, imagination encircles the world. And my last statement to you is that imagination and innovation will outweigh knowledge if we are to optimize the usefulness of digital healthcare tools. And that's all I have for you by way of pictures and words. And I'm now here to talk to you and have questions if you have them. Thank you.
Thanks very much, Alan. So we have a few questions in the chat. If you can, if you can access that.
I've turned off my slides now, so I'm with you in whatever way you want.
Very well. So yeah, I can read you the questions that we have so far.
Yeah, you can, please do.
So firstly, from Peter Chuck, we have: comparing to the industry in general, IT infrastructure in many hospitals is still very old, as demonstrated by the ransomware attack, with hospitals still using Windows XP a few years ago. How could the hospital sector catch up with the rest in general?
Well, I think I'm not suggesting that digital healthcare is going to obviate the need for investment in facilities. That will have to happen anyway. But I think what the movement more and more towards self-care where it can happen, and home care and community care will do, is we won't need so many big hospitals. But governments around the world have to address the issue of the need for facilities which is something a little bit different. So I don't think there would be any way that we can't do without the best facilities. We will need operating theatres, although robotics, surgical robotics will help us a bit there. But there's no way that we should think we can get away without doing our healthcare in proper ways, and where we need them, having proper hospitals. Another question?
Yeah, well, the second one isn't so much a question, but it's a post from Orla O'Sullivan, who says she is deaf and visually impaired, and she's the CEO of Vibroxo Sound Senses CLG. I hope I pronounced it right. She's a musician and plays piano, and she wants to make music accessible to everyone and anyone in a new way. And she posts a link to a YouTube video showing the technology that she has developed. So that's there if anyone's interested in having a look at
Yeah,
that.
that I might say just one thing to the lady as well, that I've been involved as a director for the last few years for a company that is doing one thing that may be helpful, particularly to someone like yourself. We're working on improving the quality of sound delivered by mobile phones to people with hearing impairments. And there's a company formed to do that. And I could probably provide some information if you connect me with her.
Okay, thanks, Alan. And if anyone else has any other questions, you can add them in the chat, or you should now be able to unmute yourself if you want to talk aloud. I was wondering myself, you talk about how, you know, there's not an ivory tower of knowledge anymore, and that it's all accessible to everyone. But the thing that maybe counters that and goes against that, I suppose, is a sort of a rise of anti-science thinking and anti-intellectualism. And I wonder how you think we overcome that as a society.
Well, it's always been part of life, hasn't it? Anyone understanding the words, when I think about English history, going back to the Luddites, the people who opposed progress because it would change things in a negative way as far as they were concerned. And the conspiracy theorists who say that COVID is due to mobile telephone technology and stuff like that. I don't know. I have no perfect answer to how we deal with it, but I think we just have to confront these issues and stick to our knitting and be factual and seek to educate people as far as we can, or enable them to access the truth. At the end of the day, we all make our own decisions on information that reaches us. I think governments can help a very great deal. And certainly what I saw happening in China, where there is not a very good level at all of general practice medicine, as we said earlier, and where there hasn't always been a high level of trust in the medical profession, and there is a traditional Chinese way of doing it. But the availability through organizations online like Ding Cheng Doctor and telecommunications have enabled people at least to be given access to real information that might help them. And I think we've seen a change there in the way people have begun to think about healthcare. Any other questions?
Okay, so we have a question now from Pavel in the chat. He asks, will the access to the latest technology be limited only to the richest countries? And how to help increase the reach of the latest technology, especially for countries that cannot afford such modern solutions? And does the development of technology go hand in hand with cheaper access?
That is an extremely important and interesting question. And again, it's one of those that has no perfect answer. But what I can tell you is that the availability of information and the dissemination of very low cost devices does begin to make a difference even in the poorest countries. And I can give you the example, not so much of healthcare, but in Bangladesh, where Iqbal Kadir founded the company Grameenphone some years ago and said, my people are unempowered. They have no possibility of changing things. But if they only had a low-cost mobile phone, they might learn to communicate with each other and do a lot better. And they might find that it helped their possibility to grow their communities more prosperously. And indeed, it did enable people to buy very low-cost mobile phones. It made a great difference to their lives. The lady in the village bought a phone, rented it to other ladies, earned money, bought a goat, bought another goat, and it helped the community to grow. And I think in similar ways to that, and with so much going on now, where it may not be that the so-called rich world is helping the less rich world as well as it should, but a lot of people are making big efforts. I mean, I am trustee of an organization which has a range of cafes we are opening in Cambodia in order not only to provide tourists with good food to eat, but to provide books and to provide education for the local people in order that they can develop their entrepreneurial skills. And there are many, many activities in the charitable sector that are doing very, very good work. But I have a personal view that the so-called wealthier nations ought to be much more concerned about helping those that are not in the same position. And I think that some of us have got to keep working hard to make that happen. A lot of the things we're talking about also may very well not cost that much money. You know, it's very interesting how fast mobile telephony has invaded the world, isn't it? Now, even in the poorest countries. I mean, if you look at a country like India, which is vast, where there are very many poor people, mobile telephony has made a huge difference. Half the people still don't have mains electricity, but virtually all of them, or many of them, have a mobile phone. So the digital activities, more generally than just in healthcare, I think are making a big difference to the world. Is there another?
Yeah, we have a question from Peter who says, I teach healthcare informatics to nurses, mostly Chinese nurses. And he asks, how do you see digital technology changing how nurses do their jobs, especially since the pandemic?
I can see many, many ways that nurses can be assisted in doing their jobs and in focusing their time and attention on what the patient really needs from them, rather than perhaps very many menial tasks can be alleviated by digital healthcare. But I'll give you one example that's going on in the intensive care unit across the street from where I live, because I live near a hospital and I work very closely with the doctors there and I know them personally. They've done something very interesting there. In intensive care, one of the biggest problems, because so many of the patients are put into comas and then they come out of comas and they're very, very sick and they're intubated, so they can't speak and they can't communicate. And what they've done at that hospital, and we formed a company to develop it actually, it's called My ITU Voice, the company, and we've used iPads which enable the recovering, close to death intensive care patient to communicate to the nurses and the nurses to the patient and the patient to the doctors and the patient to the families. And it's a very interesting human approach to intensive care. Intensive care specialists are, of course, focused on saving lives and reviving organs that are not well. But what is often overlooked is the mental state of the patient at the same time. So My ITU Voice is enabling the recovering patient to communicate effectively, and not only with the doctors and the nurses, but with the family at an earlier stage. So that's just one example. And there are other examples. What I just mentioned about the rapid diagnosis of sepsis and the kind of bug causing it. It saves nurses all sorts of time in taking more samples and communicating with the lab more frequently. So I think the reduction in things that are either irksome or the improvement in the way they can communicate with the patient, there are just two things there that I think can be very, very helpful. And then that's I've been out there, I've been over there on the wards, and I've seen what happened, and I've actually communicated with these patients myself. And the nurses like it very much. Something else?
No more questions in the chat, so if anyone else has anything to ask. Okay, and otherwise we'll wrap up now, I suppose. Yeah. Thanks very much.
Well, thank you very much for listening, and anyone that wants to have the presentation, it is already in the hands of Wen. So he can distribute it to whoever wants it. And if anyone has any questions that have arisen in your minds as a result of this talk, you should feel free to contact me if you want to, and I will definitely respond.
That's great. Wen has left the email addresses for himself and for Alan in the chat as well, so you can find them there if you want to contact either of them.
So thank you so much for joining me.
Thank you, Professor Allen, and then thank you, everybody. So yeah, hope you enjoyed the workshop. Then again, if you have any questions or wants to talk to us, yeah, feel free to reach myself or Alan. So we have the emails there. Thank you, guys. Have a nice evening.
Bye-bye,
Afternoon.
everybody.
Bye.
Bye.
Bye.